SkinnyMedic is going to come up here, and he has been an EMT for 10 years and has done a lot of instructing, a lot of EMTs. He's now running an ambulance service here in this county, but has a lot of experience with the medical field. So let's welcome SkinnyMedic.
Like Don said, I know I look like I'm 12 years old. I think I'm getting a little older. I have to shave like once a week now, so I'm getting a little older. I have been in EMS for 10 years, and now I'm a desk jockey, running a private ambulance service. So I am a prepper. I am a rookie compared to some of you guys out here. I do live in a small subdivision. I have about 1.5 acres, but it works. I make it work for me. So it is possible to do it without having 20, 30 acres of land. It's just a bit more creative. So I do have a YouTube site. If you've watched it, you know I'm very excited about my rain barrel. So I'm working on it, but I did figure out that 55 gallons fills up very, very quickly. So I've got to work on that. I am going to be talking about gunshot and knife wounds, how to treat it, what to think about, basic trauma. But I wanted to cover some real quick things that I've been thinking about, and I wanted to cover just off topic. How many people here are on oxygen or know a direct family who's on oxygen at night? What happens if your power goes out? I can't tell you, every time we have a big snowstorm in this area, how many people I take to the hospital because their O2 concentrator is dead. There's no power to it. So they have no oxygen. You can keep the little small E-cylinders around, but how long does those last, you guys? Not very long. So you've got to be planning on thinking about that, even if you're without power just for a snowstorm for 3 days. Okay? Now also, the ER is overcrowded. So your pre-hospital care goes down. So you guys need to think about that. How are you going to keep power? Can you keep extra cylinders there? Maybe a generator, stuff like that. IV supplies, you can order that stuff off the internet. You can get just about anything off the internet. You can get IV supplies if you need it, but they're also, you need to practice this. If I tell you that for a gunshot and knife wound, you really need to start an IV on them. When it hits the fan, it's not the time you'll be trying to stab somebody with a needle. Okay? So think about that. Stitches, I had some questions asked last night about, okay, can I do sutures? Can I, stitch myself up? Absolutely, you can. Once again, internet's a wonderful place. You can order all that. There again, when you've got your arm gashed wide open, it's not time to practice and trying to sew your arm back up. You can get some chicken, get some practice sewing that. Because when it hits the fan, it's not the time you want to start practicing. Expired meds. We kind of talked about the food stuff. They kind of have to cover that. We send all of our expired medications overseas. They're still perfectly good over there. So hold on to those, okay? You never know, you might need some expired medications. Also, natural meds. We talked about, there's one lady back here somewhere, she was back there. Diabetes, okay? What happens if I run out of my insulin? That has to be refrigerated. So if you lose power for 3 days, week, long term, what's going to happen to your insulin? It's going to go bad, you're no good. So do some research, start thinking about, there are natural ways to control diabetes without taking insulin. Now, I'm not telling you to stop taking your insulin, okay? Don't do that. Don't go to the doctor and say, oh, he said I can stop doing that. Don't. But, there again, here's the time to start practicing. Okay? Because when it hits the fan, it's not the time to go, oh, I'm out of my insulin. Let's try this, try that. Okay, it's not the right time. While you can monitor, you've got the strips available, it'd be a good time to start at least playing with the idea. Okay. Also, everyone just, like the first aid kits out there, I've looked at them. The ANT3 one is a great one. But there again, you've got all these big fancy first aid kits and you have no idea what they can do with it. You're like, oh, I'll stick this Band-Aid here, stick that Band-Aid there. No idea. You've got to practice it, okay? That's one of the reasons they call it practice in medicine. You need to play with it, okay? If you've got a bandage, a wound, splinter fracture, arm, leg fracture, when it hits the fan, it's not time you want to start practicing that. When your little girl who fractured her arm, you've got to try to splint it and she's screaming her head off, not the time you want to be playing with her arm. Okay? So you need to practice, play with. Take a first aid class. You can take a Saturday, take a basic first aid class. We can give you the basics. But make sure you're playing with this. Okay, back on my topic. Gunshot knife wounds. Basically, this makes it real easy because this is all penetrating trauma. You got blunt trauma, which is if I take a baseball bat, hit you in the side of the head, that's blunt trauma. Penetrating trauma is when I shoot you in the head. So, big difference. I have no idea how to work this one. This is awkward. There we go. Penetrating trauma. Injury occurred with an object such as a knife or bullet penetrates into the body. Okay, that makes it simple, real easy. If you get into a car wreck, your chest hits the steering wheel, that's blunt trauma. Penetrating trauma is actually someone enters into the body. Oh no. Alright, I should have warned you. Sorry, if you have small kids, you might want to cover their eyes. Did not have any graphic photos until David and Scott said, oh, we want to see some cool pictures right before lunch. So I went, looked, found a cool one. This is actually a lady who's having surgery. She's got a knife right into her trachea there. So she still appears to be somewhat alive at this moment. So the next one is a little more graphic. So if you have small kids or you don't want to eat pizza, probably. This is a nice 12-gauge shotgun to the head. You can also see his jaw, everything's displaced, the brain's there. So it's not like you see on movies, okay, guys? Blood stinks, it smells awful. If you get a lot of it, it starts smelling, and it gets everywhere. So it's not like the movies. This is graphic. So if you're going to see this, this is what you're looking for. It's obvious what his mechanism of injury is here. When a bullet enters into the body, it creates a permanent wave cavity that's going to go through. So your 40 caliber, your 45 caliber, that's what's going to make the entry in hole. When it goes through the pressure wave, it's going to expand, and that's what does the damage inside the body. Okay? Unless it bounces off a bone or something. But this pressure wave here is going to collapse all your hollow organs. Okay? That's where your lungs collapse. That's bad. Okay? Your kidneys, all that, the pressure wave is going to damage them. Okay? That's bad. Kidneys shut down, lungs shut down, you're in bad shape. When it exits out of the body, this is where that pressure wave's coming out, and this is where you see the big explosion coming out. That's why you get your explosive entries and exits, because of this pressure wave right here. Your extremities. You get shot, stabbed in extremity. Generally, unless you hit a main artery, it's not that bad. You can control bleeding, no big deal. Like I said there, 60 to 80% of these injuries, less than 10%, you're going to die. Not that big a deal unless you hit a major artery. Abdominal injury, including the pelvis, you're going to bleed a lot. Okay? I changed it to red because I thought it was going to be cool and you can't actually read it. So you can lose 2 liters of blood inside your abdominal cavity and your pelvis. Okay? We have about 5 to 6 liters in our body comparing our body size. Okay? 2 liters, that's a lot. You're definitely showing signs of shock there. If you don't get something fixed, you're going to die. So you've got to be cautious of that if you see someone that's been injured in the abdominal area. The thoracic cavity, okay? The heart's there, the lungs there. There's a lot of vital organs there. That can hold right at 4 liters. Okay? We just said you have 5 to 6 depending on your body mass. So if you got someone who's shot in the abdomen and the chest, guess what? They're dead. They can bleed completely out in their chest cavity, in their abdominal cavity, and there ain't a dang thing you can do about it.